You know, many Americans live with chronic pain, and that's what we're talking about today. Dr. Connie is with us, Dr. Connie Casebolt Carver. You're at Wellness by Design. You brought a patient, a client, and this is Amy. Hello, Amy.
Hi.
Did that nice lady help you?
She did. She did. I found her. She was on this show a couple of years ago, maybe a year and a half. My husband, Robbie, saw her, and he knew what I was dealing with, what she was talking about. He thought maybe she could help, and I got in there, and it started off 10%. I started to see improvement with my fibromyalgia, and then I went back again, and it was just better and better each time. And I really had been through the ringer for 2 years with a rheumatologist, I think a long list. A lot of people who have chronic illness know what I'm talking about.
Right.
There's a lot of pharmaceuticals to help mask pain and chronic pain, but there's no treatment to get better.
So when you say chronic pain, explain to our audience what you were dealing with. What was your life like?
Right, so I had 3 children. I had always been healthy. I ate healthy, I exercised. One day I just came down with something. It was a migraine, and within a month it had spread from the top of my head to the bottom of my feet. And I think it was about 3 months before I was able to leave my room.
What?
And yeah, and we started with neurologists. I mean, I was no longer able to drive, hold my head up even, was just
with 3 kids, y'all. Like, I mean.
So my husband, you know, he had to be the nurse. You know, he was the nurse for me and taking care of our children.
Well,
Our whole life
like John
changed.
Wayne over here sitting on a horse. Dr. Connie, is it normal that fibromyalgia sometimes is an early diagnosis for MS?
It can be. And so she's brought up a really good point, which is that modern medicine is more about masking symptoms with medications, but there's really no training in medical training, residency, school, et cetera, to find out the root causes and fix that. And in her case, as in every case, we did some diagnostic work, we did some tests, and we found out that she would benefit from ozone, so she was one of our ozone patients. We not only gave her some IVs, we also injected ozone directly into her pelvis, which sounds terribly painful, but it really isn't.
Why there?
Because the uterus is diseased, and ozone has this overall curative sort of property. Not everybody needs that, however.
Yeah.
Right, so I had just like, I had layers on layers of symptoms, with the only name I was going to get was fibromyalgia, one of those being endometriosis. So the ozone did help with my bone pain, but also helped with endometriosis, which women who have that.
Right, and just in case people
there's
don't
no
know.
cure.
Right.
There's no, I mean, not that I knew of before I met you.
Your periods were just miserable, lasting for a long
I
time.
had maybe one good week out of the month.
Yeah.
Oh my God, that's
One
not a
good
way
week.
to live.
Yeah.
But you
And
know,
I was
being a
just run
weatherman,
down.
the
I
word
was just
ozone
depleted.
it blows my mind. Is it in liquid form? Is it
It's a
an
gas.
injection? It
yes,
is a
and
gas.
it's a very minute quantity, so it's controlled.
Okay.
And of course, we use medical grade oxygen and then an ozone generator.
Okay.
And of course, not everybody needs ozone, but it is one of our, we call it our miracle molecule. It is something that we can use, so we can inject it into joints for pain, into lots of soft tissue, the pelvis in her case, and it really doesn't hurt. On a scale of 1 to 10, I would say it's a 1, maybe.
Yeah,
it's
no
nothing to be
downtime, no
nothing
bad
to be fearful
symptoms, and really painless.
You
It
give
really
her an
is.
A+?
A+.
Can't get any higher.
She knows I'm a patient for life for her. My family knows too.
That's great.
But here's the cool thing, she doesn't need to come in that often anymore because we've really got her to a level. So it's not that we get people just, you know, stuck with us. We try to get them more or less cured so that then we just do maintenance work on them. So
I'm an esthetician, and now I'm able to go back to school for medical, which is something I've always wanted to add on to it. There's just no way that I would be here today without Dr. Connie.
Without her. So if you're one of those people and you're like, okay, this sounds like me, or I've got a friend, you need to come out to the seminar, which is next Tuesday.
that's right, a week from tomorrow, which I believe is the 12th.
The 12th.
6 o'clock sharp. We do start on time. We're sticklers for that. You do need to RSVP, which either can be on our website or by calling, I think the number's on the screen.
It is.
Yes, ma'am.
And we'd love to see people because we do have answers for chronic illness. If you're desperate to get permanently better, this is the place to come.
Okay, it is the 12th. It's Tuesday night. 6, you say 6 or?
6 o'clock.
6 o'clock, and they will lock the door, so you need to make those reservations. They won't lock the door on your arm if you're trying to come in.
That's right.
But it is a Q&A session of things to do.
You won't be sorry. I think anybody that is normally healthy wouldn't be sorry to to be there and learn some more.
She might be a good one to have at your next
I know,
seminar.
right? Yes, great job. Thank you so much, and thank you for sharing your story. Very good. All right.